Mr. Speaker, the right to access healthcare services is encapsulated in quite a number of important international documents which have been ratified by our country, Ghana. Of importance are Article 12 of the International Covenant on Economic, Social, and Cultural Rights, Article 25 of the Convention on the Right of Persons with Disabilities, Article 11, 12, and 14 of the Convention on the Elimination of All Forms of Discrimination Against Women, and lastly, Article 25 of the Universal Declaration of Human Rights, which places emphasis on the importance of health as an absolute right of an individual. Mr. Speaker, disability is defined as a condition of the body or mind that prevents a person from doing certain activities and limits their interaction with the world around them, which the World Health Organization has categorized around 3 dimensions: impairment, activity limitation, and participation restrictions. Some of the types of disabilities affect the vision, movement, thinking, mental health, communicating, and hearing. Mr. Speaker, my statement concerns mostly the disability of communicating and hearing, which we mostly refer to as deaf and dumb. The Convention on the Right of Persons with Disability is one major document that ultimately stands out on issues relating to people with disability. In Article 1 of the Convention, this document emphatically spells out the role of the state in promoting, protecting, and ensuring the full and equal enjoyment of all human rights and fundamental freedoms, as well as the inherent dignity of all persons with disabilities. The Article 25, which focuses mainly on the role of the state to ensure their right to enjoy the highest attainable standard of health services as provided to other persons in the country, is my concern today. Mr. Speaker, despite the ratification of the goals of these international documents and some gains made to improve the livelihood of persons with disabilities in Ghana, they still face other challenges in life, especially access to quality and standard health care. According to the World Health Organization, such persons are about 3-fold likelihood to be denied medical care and 4 times increased likelihood to receive substandard care from health professionals. This is due to several factors such as low income, inadequate government policies targeted at persons with disability, low levels of education, lesser economic opportunities, inadequate knowledge of healthcare workers about how to interact with persons with poor infrastructure. The majority of persons with disability find themselves among families from poor homes. The financial challenges in taking care of such persons with special needs make it much more difficult for them to enjoy the quality and standard health care that they need. As a result, families with such low levels of income cannot afford to give such luxury to their relatives who are disabled. Secondly, persons with disability are less privileged when it comes to economic opportunities. They hardly get jobs that pay very well because they receive less education opportunities in our society. Only few make it to the university to pursue careers as normal people do. This creates a situation where they are unable to provide for themselves, thereby making it difficult to enjoy quality health care. The inadequate policies of government targeted at such people makes it challenging for them to enjoy quality healthcare service. Making reference to the various health policies of government, some policies don't even mention disability, and those that do mention it in the general context. Such policies, like the human resource policies and strategies for the health sector, the Ghana National Healthcare Strategy, Health Sector Staffing Norm, and the revised National Health Policy. Mr. Speaker, how many of our health professionals are able to communicate with the deaf and dumb at our hospitals, both private and public? Unfortunately, most healthcare workers have inadequate skills in sign language, making it difficult for them to interact with the deaf and dumb at our various hospitals. Mr. Speaker, we have the sign language expert on television interpreting news, parliamentary proceedings, and others, but healthcare sectors where they are most needed, we don't have them. Such experts are absent. Though we have to commend the Ministry of Health and the Ministry of Education for instituting the sign language course at various training institutions, It is certain that a semester course in sign language is not enough to acquire the skills to communicate with such persons. Unfortunately, these factors are interconnected and expose persons with disability to adverse health problems such as feather deficiencies, poor health conditions, sexual abuse, sexually transmitted infections, unplanned pregnancies, miscarriage, severity and chronicity of avoidable health conditions leading to low quality of life. Mr. Speaker, I would like to draw the attention of the House to the fact that women and young girls with this disability are the most vulnerable in our society. Many of them suffer from rape and other injustices from family and sometimes strangers, yet their inability to communicate makes it difficult for justice to be served and necessary medical attention given. I would like to refer the House to an online publication of Tuesday, 21st December 2021 by Ghana Talks Radio with headline, Father Impregnates Own Deaf and Dumb Teenage Daughter at Pifo in Konohu. A terrible incident that happened where a father impregnates his own daughter. Mr. Speaker, available data shows that the number of persons with disability keeps increasing. The report of the 2020 Population and Housing Census makes it evident that the increase in population growth is coupled with an increase with the number of persons living with disability in our country. For Ghana to meet its goals on the provision of the high quality and standard healthcare services for the persons with disability, we recommend, first of all, to conceive a database on persons with disability in the country. Ghana as a country stands a better chance of understanding such people in order to resolve their numerous challenges. Mr. Speaker, I recommend the Sight Savers International for their work on the disability disaggregation project, which was conducted between the year 2016 and 2018 at Kintampo North District and Tano South District of the then Brong Ahafo region. Their report concluded that the collection of data on people with disability is feasible and has pragmatic benefit for the country when it comes to social economic development planning of our country. The government statistician, through the Ghana Statistical Service Department, could assess technical support from the Washington Group on disability data through our development partners in order to develop instruments and skills needed in this regard. All government policies must include persons with disability to better cater for their needs, especially the health policies in our country. The semester program for teaching sign language as a course at the various training institutions is inadequate, and the framers of the course outline must go back and develop more effective outline that will equip and help professionals with that particular skill. There should be a mandatory policy of government through the Ministry of Health demanding all health workers acquiring the skills of sign language. I would like to encourage some members to join in pushing for the Ghanaian Disability Act, which will take care of such concerns. Mr. Speaker, I thank you for the opportunity to make this statement.